Hi, so this is my pamphlet on for detecting ADHD. So on the right here, you'll see detecting ADHD would be like the opening side of the pamphlet. The references page would be the back page of the pamphlet. And then important things to remember if you have a child with ADHD would be like the middle flap. So we'll just get right into it. So important things to remember if you do have a child with ADHD. So the first thing to remember is that children with ADHD do not have a deficiency in intelligence. Um, and another thing important to remember is children are not usually diagnosed until 4 years of age because symptoms can be similar to normal behaviors of a 2-year-old with like just like normal behaviors of what a 2-year-old has. Um, the third thing to remember is unintentional injuries such as lacerations or burns can be very common just due to like their temperament and their impulsivity. The fourth thing to remember is medications. So if they do choose medications as part of their treatment, that medications for ADHD often cause insomnia, anorexia, due to the decreased appetite. So here's the reference that I used, and these are just for more information, different websites and different places that parents or the child themselves can go for more information on ADHD. So, what is ADHD? So, ADHD is attention deficit hyperactive disorder. It is a persistent pattern of inactivity or impulsivity symptoms, or both, present before the age of 12 that causes impairment in at least two settings. Um, the causes, so there's no known cause for ADHD. However, there are some factors that contribute to ADHD, such as environmental, which would be like having a low birth weight, genetic, physiological, and a family history of the disorder. So if like your parents were to have it, it's more likely that the child will have it as well. So some symptoms, there are three major behaviors that indicate that ADHD is present. So that would be inattentiveness, impulsivity, and hyperactivity. These can present so these can present as difficulty organizing, reluctant to do a task that requires mental focus, or trouble waiting. Um, So, some environmental modifications. So, this would be one of the most important things is to limit the number of distractions that are in a child's learning environment. They also may benefit from educational accomplishments such as having, or excuse me, education accommodations such as preferential seating, would be like maybe sitting in the front or close to the teacher, extended time for tests, and note taking. Some behavioral modifications. So, behavioral therapy can also be very beneficial for children with ADHD. This therapy is aimed at finding ways to control impulsivity and attentiveness by creating goals to achieve. There's also pharmacological therapy. So, several medications can be helpful in reducing the excess activity, lengthening attention span, and decrease distractibility so it is easier to function in school. A common medication that is used is methylphenidate or amphetamine and amphetamines, which is also known as Adderall. So, one side effect to be aware of is that these medications suppress appetite and can lead to malnutrition. So, those would be important things to highlight. Um, when going through like a pamphlet like this with a parent or a child that has ADHD.